Even if your blood test results for celiac disease came back negative and you're still not feeling very good, so what do we do now? Suppose you've been experiencing symptoms that seem to be related to gluten. In that case, it is conceivable that you have non-celiac gluten sensitivity, also known as gluten sensitivity or gluten intolerance. If you've been suffering from these symptoms, consult your doctor. Hello everyone, and welcome back to our channel. Before we continue, make sure you smash that like button and subscribe to our channel for more videos like this one. First and foremost, it is essential to have a solid understanding of what celiac disease is. Celiac disease is a multi-system autoimmune disorder brought on by the consumption of gluten in those genetically predisposed to developing the condition. Patients who have this prevalent illness, which affects around 1% of the population, may exhibit a wide array of symptoms, both intestinal and non-intestinal in nature. Autoantibodies, such as tissue transglutaminase antibodies, endomysial antibodies, and deamidated gliadin peptides are created in the body. These autoantibodies serve as the foundation for serological tests that are utilized for screening. A small intestine biopsy is performed to confirm a diagnosis of celiac disease, and the treatment consists of adhering to a gluten-free diet for the rest of one's life. Maintaining adherence to the gluten-free diet leads to a reduction in gastrointestinal inflammation and symptoms. With time, the patient's autoantibodies change from positive to negative. Patients with celiac disease have an increased chance of developing nutritional deficiencies, other autoimmune disorders, and, in some instances, cancers, such as a small intestine lymphoma. This is because celiac disease is a severe disorder. Non-celiac gluten sensitivity. Because non-celiac gluten sensitivity is commonly a self-diagnosis, it is challenging to determine the true prevalence of the condition. At this time, there are no known biomarkers associated with this condition. According to the National Health and Nutrition Examination Survey, conducted in the United States, between 0.55% and 0.63% of the general population followed a gluten-free diet, even though they did not have celiac disease. This prevalence is comparable to that of all instances of celiac disease, both those who have diagnosed and those that have not. The symptoms of it might vary quite a bit from person to person. Irritable bowel syndrome is a condition that can be mimicked by these symptoms, which include bloating, having stomach pain and diarrhea, from constipation to having nausea, mouth ulcers, and acid reflux are some of the additional digestive symptoms that can occur. People with this condition might experience symptoms unrelated to their intestines, such as feeling really ill, lethargic, having headaches, mental fogginess, numbness, joint problems, or even a skin rash. One or more symptoms could be present in a person at any time. Now, because the clinical symptoms of celiac disease and non-celiac gluten sensitivity are similar, it can be challenging to differentiate between the two conditions. Well, this is based solely on the patient's symptoms. Individuals with celiac disease were more likely to have a positive family history or personal history of other autoimmune disorders, and nutrient deficiencies in one research of adults. This was in comparison to patients who did not have celiac disease. Here are early signs that you might be gluten intolerant. Number 1, diarrhea, constipation, and smelly feces. After eating gluten, Those who have celiac disease have inflammation in the lower part of their small intestine. This causes damage to the lining of the stomach, which results in poor nutrient absorption. This in turn leads to a substantial digestive discomfort and recurrent diarrhea or constipation. The loss of electrolytes, dehydration, and exhaustion are just some potential adverse effects of frequent diarrhea in one's health. And in addition, because of the impaired ability to absorb nutrients, those with celiac disease may have pale stools and an offensive odor. Number 2 is fatigue. People afflicted with autoimmune illnesses such as celiac disease frequently complain of experiencing fatigue in their daily lives. It is believed that people who have celiac disease experience exhaustion for a variety of reasons, including persistent hurting, sleep disruption, psychiatric disorders such as major depression. A higher risk of iron deficiency anemia, which is a condition that impairs the body's capacity to make healthy red blood cells, may also be associated with celiac disease. This association has not been definitely shown, however, and this may result in several significant adverse effects, including a fall in energy levels and tiredness. Number 3 are the reactions of the skin. The inability to digest gluten might also have an effect on your skin. The skin condition known as dermatitis herpetiformis, which causes blistering, is one of the manifestations of celiac disease. And some people with celiac disease do not suffer the digestive symptoms characteristic of celiac disease, even though everyone with celiac disease is sensitive to gluten. And in addition to this, patients with various skin problems have exhibited signs of improvement when following a gluten-free diet. And these are the following skin conditions. Psoriasis. This is the scaling and reddening of the skin and are 2 symptoms of inflammatory illness that affects the skin. Another is alopecia areata. This is a form of hair loss that does not result in scarring and is caused by an autoimmune condition. The next is chronic urticarial. This is a skin ailment that manifests itself as recurring lesions that are pink or red in color and have white cores. Number 4 is depression and anxiety. And each year, approximately 6% of Americans are affected by depression. The symptoms, which frequently include feelings of hopelessness and sadness, can significantly impact one's day-to-day activities. Individuals with no underlying problems are less likely to have anxiety and depression than those who do. Now, in contrast, those who do experience anxiety and depression are more likely to have digestive issues. And people with celiac disease have an increased risk of developing mental health conditions such as depression and anxiety. There are a few hypotheses regarding the connection between gluten intolerance and depression. These are the following: the levels of serotonin that are not usual. And serotonin is a neurotransmitter that enables the cells to connect with one another. And since lower levels have been linked to feelings of depression, it is generally referred to as one of the hormones that contribute to happy. Gluten exorphins are peptides produced as a byproduct of the digestion of specific gluten proteins. They can potentially disrupt the central nervous system, which can increase the likelihood of depression. Alterations in the composition of the microbiota in the gut can affect the central nervous system and raise the risk of clinical depression. These alterations include an increase in the proportion of pathogenic bacteria and a reduction in the balance of helpful bacteria. Number 5 is unexplained weight loss. A change in weight that did not occur naturally typically causes concern. The undiagnosed celiac disease frequently causes patients to experience unexplained weight loss, even though this symptom might have a variety of causes. In an older study, including patients with celiac disease, researchers found that 2/3 of the participants had experienced weight loss in the 6 months following their diagnosis. The weight loss may be due to various digestive issues and inadequate food absorption. Number 6 is iron deficiency anemia. Iron deficiency is the most frequent type of iron shortage, and it is responsible for 50% of all instances of anemia around the globe. And a lack of iron in the body can result in symptoms such as insufficient amount of blood, causing fatigue, a feeling of difficulty in breathing, dizziness, headaches, pale skin, and weakness. The inability to properly absorb nutrients in the small intestine is a symptom of celiac disease, and this leads to a decrease in the quantity of iron absorbed from the food we eat. Anemia caused by a lack of iron is likely one of the first symptoms of celiac disease that a medical professional sees in a patient. And number 7 are autoimmune diseases. Celiac disease is an autoimmune disorder that results in your immune system attacking your digestive tract after you consume gluten. This happens because celiac disease is an autoimmune disorder. This autoimmune disorder makes you more prone to other autoimmune diseases, such as autoimmune thyroid disease. And in addition, autoimmune thyroid problems have been linked to an increased likelihood of developing emotional and mental disorders. Because of this, celiac disease is more prevalent in individuals suffering from autoimmune disorders such as diabetes type 1, autoimmune liver diseases, and inflammatory bowel disease. And finally, number 8, joint and muscle pain. There are a variety of reasons why people suffer in their joints and muscles. There is a hypothesis that individuals with celiac disease have a neurological system genetically predisposed to be hypersensitive or overexcitable. Therefore, they may have a lower threshold to activate the sensory neurons that generate muscle and joint pain. Well, that's all for today. What do you think of all of this? Feel free to let us know in the comments section below, and thanks for watching, and I'll see you on the next one.